And the Executive Director for Health and Community Education at Piedmont Healthcare in Atlanta. I hate that you're not here with me here in studio in Atlanta, but hey, if you're going to be out in
I
Amsterdam,
know.
that's all fine with me too. So thanks for joining us. So first off, tell us more about this variant, Dr. Morgan. I mean, how widespread is it, and people who are getting this variant, how bad or not is the infection?
And so we have three variants now, the XBB.1.5 and also the EG.5. Those are the ones that are rapidly becoming the most dominant variants in the United States and also around the world. As you noted, I'm here in Amsterdam today. But then we have this BA.2.86 variant, which is an offshoot of Omicron, but another branch of the Omicron family, this BA.2 branch. And so far, this particular variant has been interesting in that the World Health Organization has given it a connotation of a variant under monitoring, even though it doesn't specifically fit the criteria. In fact, the World Health Organization altered the definition to include this particular variant, specifically to include the fact that it has an unusually large number of mutations without a lot of genomic sequencing, and that it's unclear what its evolutionary advantage will be. Generally, variants under monitoring show that they can outcompete other variants. This variant is not showing that it can outcompete. So the World Health Organization altered its definition just to include this variant.
Generally, though, how sick are people getting from COVID this time around? Are we seeing it coming in a milder form?
And so far, the disease appears to be the same as the rest of this Omicron family. Don't forget, we are still in Omicron. There's so many sisters and brothers and cousins, it's hard to keep up, but this is still Omicron. And we're talking now about two offshoots of the same family, the same lineage of Omicron. So all of the symptoms are still the same, fairly mild. That being said, we have people who are immunocompromised or challenged in other ways. We certainly see hospitalizations that have nearly tripled in the last 2 months across this country, still not anywhere near the peak of where they were, but we have seen that trajectory, unfortunately, going in the wrong direction. And in August, we're almost at 3 times the number of hospitalizations that we had in June.
So who should be wearing masks? Should we be wearing masks?
Amra, I am here in Amsterdam at the European Society of Cardiology conference. This is the largest collection of cardiologists that come together every single year from all around the world, 30 or 40,000 of us. And I have been speaking to my German colleagues, my Dutch colleagues, my French, my African, my Moroccan, and all of us are having the same conversation with regard to whether it is time to have patients coming into the office and staff masks, because as you know, patients are also the public. The public comes in, and what are those exposures to your staff and to the people with whom you employ there in your offices? And so we all have been having this conversation for the last couple of days. And I think everyone is waiting to see what is going to happen with BA.2.86. We certainly don't want to jump the gun, but doctors, certainly cardiologists here, are very much aware of the uptick in hospitalizations, emergency room visits, and even deaths. Very
Yeah,
much aware of it.
I'm definitely seeing more and more people wearing masks. I just got off an airplane yesterday, and I was wearing a mask just to keep others safe in case, my cough, might be an issue. Let's talk about the
And
vaccines.
Amber, I
Mhm,
flew here to Amsterdam,
mhm.
and I was one of only a few people with masks on as well. I'm back to wearing a mask on an airplane as well.
Are you? Yeah, I mean, I forgot how uncomfortable it is, but I mean, hey, if it keeps others and yourself safe, why not? So